was a scoping review that was undertaken for and in collaboration with WHO. You'll remember, those of you that were with us last week, we had a policy dialogue, and Miriam Orcott from WHO was there, along with Moketsi Modisenyane from the National Department of Health. And one of the areas of work that they spoke about was a country assessment that WHO completed earlier this year, looking at health system responses in South Africa to migration, health and displacement. And as part of that, I and others at ACMS were involved in two pieces of work. One was a desk review, and we can always talk another time, run a session about desk reviews more broadly, that was looking at health system responses. And the second was a scoping review. And as you can see here, the idea was to identify existing evidence for the period 2014 to 2024. And then from that data, create a narrative, really do some analysis of the existing data and evidence to identify knowledge gaps. Sostina Martina led this with me. She is currently in Thailand presenting at a conference, so can't be here. But you'll see on the call, we've got Tanatsue, Melissa, Langa's traveling back to Zim, Blessing, Pindile, and Becky, unfortunately, couldn't join us today. But the review team were involved in those different parts of the process that I'm going to take you through briefly. This drew on, Suresh was talking about the First World Migration, the First World Report on Migration and Health and Displacement that he was leading with WHO, looking at the current state of evidence on migration and health. And as part of that, I led on the review for the WHO Afro region, which was actually when Suresh and I first worked together. And that has been published separately as a report. And there is a paper that is coming from that. So there was some background that existed that obviously went into working with WHO to finalize the specific methodology we used. Now, what I wanted to do is, it was interesting when you were talking about Ryan and then Covidence. So for this review, we used Covidence, and I'm going to show you it in a minute. I've also used Ryan, which I know is what Melissa and Tanatsue used for their reviews. And maybe it's just how my brain works. I found Covidence a lot easier to use. As with Rayan, it's about assisting you in your review. It doesn't do your review for you. And as always, the tools are, there to be used correctly. So they don't actually help if you don't then apply them correctly. So it was really good working with Sostina because she's used Covidence before. The problem is with some of these softwares, they're very expensive. And the library at WITS at the moment doesn't have subscriptions for either. I managed to negotiate with Covidence one free use of Covidence for one single scoping review. And it's been very, very helpful. So essentially, the message here is we went from many to 292. So throughout this process, you can see where we gathered all of the initial sources. The software Covidence we used identified some duplicates, 443. And then we used Zotero, and we manually identified another 72 references that were duplicated. So that removed 500. But we still then had to screen a huge number of articles. Now here you obviously screen from title and abstract. Some of them, it's very, very quick to say that they're not relevant. Maybe it's about the migration of Neanderthal man and, the kind of food he'd eaten. And so the word health came up. And even though your search strings have been designed to include commands on what not to include, because of the types of databases we were using and were requested to use, we ended up with many to screen. Through that, we screened 402 and screened those for eligibility. And from that, we excluded another 110. And there are different reasons for why those get excluded. And some of them it's surprising, but you can get this far through your process and actually find articles that don't focus specifically on health. They refer to health in there, but it's not actually the focus. Other things was the kinds of articles that were being found. For example, if it was a letter to an editor, these kinds of things. So you set up your search strings to try to exclude those, but that doesn't mean it always happens. Now, what I wanted to quickly do before I just go through the results was to show you what Covidence actually looks like when you're online. It is on, sorry, I've opened it, so I just want to find the right screen for you. So when you're in the Covidence software, can you see is my screen showing now? Yeah, okay,
Yes.
good.
Yes,
So
we can
this
see
gives you a sense of this is where we worked together, and as Suresh was saying, it's the same with Ryan, where you can work as a team and all have access to the same sort of data set, basically. Now, if we go onto the Prisma, it gives us an overview. So it shows these are the articles that were first imported. It shows you where they all came from. So in our case, there was these, you remember I was talking about articles that had come from the review articles. There were things from different sort of UNICEF database, let's say. These were from the main databases. Somebody was asking about Google Scholar. That was one of the search engines we used. We then outlined how many duplicates were removed. And then this shows you what we went down to. This number screened, the 402 that were assessed, that we excluded. It explains why. And then we ended up with our 292. So one of the things that's nice with Covidence is that it builds this sort of Prisma summary for you as you go, which is very helpful. So it'll show you here, we reviewed we screened here, we had 2 people screening, the full text reviews, how many full texts were reviewed, where we had data extraction, and this is where let me see if I can show you. I'd set it up so we could see. This is where the extraction database, so it's similar to the Excel form that Suresh was showing. So for example, you can see here that Blessing and Sostina agreed on this. They both did the data extraction, and then we combined. So I'm not going to go through it all in a kind of confusing way, but just to share with you, this was the data extraction template. So it's looking at issues about where we wanted to also be able to comment. It wasn't a bibliometric analysis, but we wanted to know where the lead author is based, where the co-authors are based. But importantly, it was about the type of study design. So you fill it in. There's a simple database. You fill in your data extraction. So when you've reviewed the article, you can indicate what kind of context the study was in, migrant population included, all these sorts of things. Where the study was undertaken, remember that it was a focus on South Africa. So it could be a multi-country study, but South Africa had to be one country. And otherwise, we tried to provide as much detail as possible about who was the focus of the study. Now, once you've got all your data, you then obviously need to do some analysis. Now, I'll show you of some of the ways that once you've got all your data, we don't have time to go through it today, but there are different ways that you can visualize this data. And one of them is through using these kinds of infographics. So from the studies that were all included, which was 292, these were the main theme that the articles were sort of organized by. And you'll see that access to services and HIV remained the greatest themes of which the articles fitted into. But what do here, and this is something that I have enjoyed trying to learn, is HIV. Well, what about HIV? Right, well, most were about internal migration in South Africa and HIV. There were some that were about sexual reproductive health and HIV, sexual reproductive health and HIV, some about women and HIV. Then we know that you can then say, right, well, there's a lot of mental health. What was going on here? We see that the majority of them focused on refugees. So that matches and mirrors what Suresh has been talking about. So there's different ways you can present your data that can help you with your own analysis and the ways in which you pull it all together. But I'll just quickly, and we could maybe run a session on that at some point with some of our colleagues who are far better adept at using these sorts of visualization tools. So the main message is we ended up with 292 publications. And from this, we were able to look at the different kinds of publications that existed. You'll see that the majority by far are journal articles. So that's this main bit. And there were 2 preprints. So those are articles that were identified online, but haven't been accepted by a journal yet. They have been submitted for review. There were 19 reports, 9 theses, which I think all of them, I think it was 7 PhDs and 2 masters, and then 5 book chapters. And here you can just see over the 10-year period if there were any changes in what was being produced. I think it is interesting that you can see for example, the numbers of student dissertations, they didn't increase that much over time, but we do see a trend in the amount overall that's being published, right? And we know that here is where we saw COVID, and we know, and I'll tell you the story about COVID here. But this is a helpful way just to get a sense of the kind of data that has been published that you are including in your review. So what existing evidence did we uncover? So we looked for key themes, and I've already shown you one way to visualize it, but this is a nice, easy way. So these were the key themes that were identified. And remember, many publications would be under multiple of these themes, but this was their kind of top, the top theme in which they were organized. So HIV and access to services, followed by mental health, trauma and violence. Then looking at COVID, which obviously if we'd stopped the search, it wasn't until 24 and we'd stopped in 2019, this whole section wouldn't exist. Sexual reproductive health, all the way through down to disability with 4. Remember, this is looking at South Africa, and it's looking at publications between 2014 and 2024. So that's the figure I've already shown you. But this gives you a sense of, over the years, where the focus area has been. So again, this COVID green, you can see here, right? So you can see that trend where we had a sudden, I mean, in 2022, a huge number and a big, those COVID papers, all of these would drop down, right? And we'd see a very different total number. HIV has remained a consistent, important topic, but, it is dropping off perhaps. I was interested when we looked at things like tuberculosis and malaria, that we know TB in particular is a huge health concern in South Africa and is directly linked to migration. But actually, when you look at it, there's not that many papers that are published, and in fact, none in 2024, none in 2022. So this tells another important story. Mental health, trauma and violence remains kind of consistent here, but you can see it's much less looked at in other times. As a total proportion, we can tell the story around HIV being more than it was. Food security and nutrition, for our colleague working on nutrition, you can see how little has been published in that, but there was a greater focus until now. So this just gives you a sense of who's publishing what and why. I was also interested, maybe because it's one of my areas of interest around policy and governance, that actually in total there weren't that many articles that focused on migration, health policy and governance. So this gives you a chance to look at trends like climate and environment. There was an assumption there'd be a lot, but you can actually see here that there were only 8 publications over the whole project duration, the 10-year period, that focused on climate, environment, migration, displacement and health. So the top 5: HIV, access to services, mental health, COVID, and sexual reproductive health. So we could say, right, here's the story of HIV, mental health, TB, and climate. So obviously the scales are different. You know, we've got up to 10 here, 6. I've tried to sort of line them up as best I can, 4, and this is only to 1. So this gives you a sense, though, of the focus on certain topics over others. And as I said, the TB story did really surprise me. I thought it would be quite different. And the prevalence of HIV didn't surprise me in terms of the number of articles, but I didn't realize that TB would be so low, for example. If we look at COVID, as I'd mentioned, we saw this big surge. So COVID is the 4th most published area over that whole 10-year period, which really tells you how the lens and focus on migration, health and displacement grew in the context of a pandemic, and grew in the context of global health security and so on. So there were people who were writing about COVID, migration and health who never previously would have really engaged with the migration and health space. So it just starts telling a story of how global health priorities and challenges can also affect what's being produced and published. These articles tended to focus on experiences of migrants around healthcare delivery. I was surprised again. I thought there'd be much more modeling studies going on, but there really were very little. And the work around vaccinations were more from kind of commentary articles and then reviews of policy responses. What we saw was almost all of these were qualitative and descriptive. I'm not saying that's bad data, but it's a different kind of data. And I was surprised that there was less work that had been done looking at modelling the relationship between migration and COVID. The main population groups that we saw that the literature focused on kind of matches some similar trends that we've seen globally, but it was a bit more complicated in our context. So obviously, somebody might be an internal migrant and be in an urban space, right? Or might also be a woman. But again, this was the main focus of the papers and how we tried to sort of stratify the papers, as it were, by those main focus areas. And what you'll see is that internal migration in the South African context is a very stable field of research. And there's a lot that is published in the field of internal migration. A big focus on rural and urban, mostly linked to one of 2 things: either an association with internal migration, so looking at people's experiences mostly in rural areas, but increasingly in urban, but linked to internal migration, or because that was where we started seeing asylum seekers, for example, or on refugee and forced migrant populations, which tended to be in the urban areas. But perhaps those numbers aren't as big as we might have thought. The focus on women is clear, and that maps onto the focus on sexual reproductive health, on maternal health care, but also on HIV. Many of the studies looking at HIV, when they were looking at experiences of individuals, did focus still a lot on women, but there was an increasing number of articles that were starting to look at the experiences of migrant men. Some studies looking at children, but again, this mostly fitted within the idea of maternal and child health. So evidence gaps. So this was work using the framework of the World Health Organization and their global migration research agenda, which has 5 key thematic areas. So 1, So they're looking at these key issues. So one, generating evidence around universal health coverage and primary healthcare, looking at emergency preparedness and responses to emergencies, looking at multi-sectoral research addressing determinants of health, evidence to explore and expand our knowledge on under-researched groups and their context, and then research exploring the research that would be based on collaborations, be inclusive and be equitable, and looking at policy change. So these are the 5 key areas that were identified at a global level when thinking about the migration and health research agenda. And what we were asked to do was then look at the so-called triple billion targets. Now these are, oh, and a nice spelling mistake. These are the 3 triple billion targets that are being used to assess the progress of countries as they move towards universal health coverage. And so one is about more people accessing universal health coverage. So this matches onto the global research priority here for advancing universal health coverage. One about more people being protected from health emergencies. So that maps onto the global research agenda, and more people enjoying better health and well-being. So again, maps onto promoting healthier populations. So it's across these sort of 3 areas that we were requested to synthesize the findings. So this is just a simple approach to looking at where we know more and where we know least, right? So we know that the data was telling us most about access around COVID, around HIV, mental health, yeah? But it was telling us less about, for example, TB or about farming, farm workers, for example. So through this, we were then able to take those 3 themes from the triple billion targets and identify key evidence gaps. And this is feeding into the development of the national research agenda, with the idea simply being that we don't need more research where we've got lots of evidence, but we need research where we've got gaps in evidence or where maybe the evidence is currently outdated. So I'm not going to go through, obviously, all of the detail, but, you know, a few is around food security, climate and environmental change, for example, some around health diplomacy, some around treatment as prevention in HIV. And obviously this was all done before the withdrawal of the USAID funding. So when we had the national consultation on this, one of the issues that came in was we'd already identified the need to think about improved evidence around intervention research, and now added to that agenda is the need to understand the impact of the withdrawal of USAID funding, for example. But what does this all mean? Why do we care, right? Why do we do these reviews? Why does an organization like WHO work with the Department of Health to generate this knowledge? You know, to identify what do we know and what are the gaps? Well, the idea is obviously all of us hope to, you know, influence something in a positive way and make knowledge to assist in that. In South Africa, we've got a couple of processes that show why this is important. So one is at the level of the Africa Union, at the AU level and the African Union Commission, where the issue of migration and health has for the last few years been a theme that they are working to strengthen. They collaborate with the IOM, for example, and in the 2nd edition of the Africa Migration Report, there was work done looking at health system planning and looking at where that fits within the AU's migration policy framework. Concurrently, IOM collaborated with Stats SA, with Diego, who many of you know, to develop a migration profile report for South Africa. And if you read the latest country report on progress towards the Sustainable Development Goals, you'll see how it clearly articulates where the linkages to migration and health sit throughout that process. In 2024, there's been 2 main, I think, important developments that are part of what we should be focusing on in much of our work. Is there has been a attention has been drawn again to the context of migrant labour in the context of the mines. And in the process of the Mine Healthy and Safety Amendment Bill and amendments to that Act, and importantly, some new work done to bring in guidance notes to the mining industry, in this case about latent tuberculosis and about gender-based violence in the workplace, safety, security for women in the mining industry. This has started showing us that there's something happening within the Department of Mineral Resources and Energy, where they are looking to improve the health of migrant workers. This is mostly linked to much stronger private sector engagement and involvement, but offers opportunities for engaging in that sector, which we haven't seen for many years. Most importantly is that in 2024, at the end of last year, a policy advisory was produced by the Department of Health, where it's probably the most explicit recognition of the need to work on the field of migration and health when we're thinking about policy and programming in the National Health Insurance. So one of the most important steps in achieving South Africa's universal health coverage objectives is addressing health disparities for migrants and refugees. So this comes straight from this policy advisory. South Africa can create a healthcare system that is resilient, inclusive, and sensitive to the needs of all citizens, including migrants, by implementing policies that address workforce distribution, healthcare access, and resource allocation. Adopting these recommendations will increase South Africa's commitment to social justice and equity in healthcare, assist sustainable development, and be in line with national priorities. Now, the reason this is important is because I've not ever seen anything from the government that has been so clear about why we need to work with migrant and refugee populations. It's not simply saying it's the right to health. It's saying this is what is needed for to achieve national development objectives. And through the evidence review, it means we can now target what kind of data is needed to support the development of improved policy. And that's where the WHO process comes in. And in March, there was the national consultation that went through the findings from both the scoping review and from the health systems assessment that was undertaken by WHO and colleagues. So we're at an interesting moment, but for me, this is when we say, so what? It's because this actually tells us a story about what we should be doing with our research next. And I would argue that this is why undertaking a solid scoping review as part of your PhD is really helpful. Obviously, every solid contained scoping review on the thematic area that you're interested in, that you've already identified, reviewing the literature and really targeting that to the specific location or the specific population or the specific time period or whatever it might be where you're focusing, this is going to help you really tighten up your research project and justification. So I'll stop there, and I'm going to ask any colleagues who are involved if you have any, open it up. Questions, thoughts, over to you. Anyone? I can't see any hands or questions, but if there is any, just shout out. Can you hear me? I'm worried I'm now sat here on my own.
Yes, we can hear you,
Yes,
Joe.
we can.
Blessing, do you want to
Yes.
reflect at all on your experience of being part of the data extraction process?
Good morning, everyone. Yes, thanks, Joe. I was wondering, like, I felt like, yeah, you had covered much of the stuff, but I think it is so important to reflect on the experiences. And I would wish to start at the question. So what, like what the last slide that you put, and once these reviews are done, what really comes, what will they become, or what use will they be of? I think it was a privilege or a pleasure that we be part of the project, and we worked with the Department of Health National, and on this project, we ended up working or towards trying to set or to create a research agenda in migration and health for South Africa. And all this came at the backdrop of this review, because it managed to expose the research gaps that were there. And during the process, what was striking for me was the process of prioritizing these research agendas. People from different research um, focus areas coming together and trying to see which areas really should we be prioritizing for the South African kind of research agenda. So I'm sure in the future, as time is progressing, we see the outcome for the prioritized topics will come out, and really see how this process, starting from this review, would show which areas should different scholars or people, or areas of interest which people should be working on in migration and health agenda. And then my reflections on the extraction process itself. It was quite an interesting process that really exposes you to a lot of literature. You go through, you begin to decide and find where and who is writing about migration and health. And it really immerses you, or it gives you an opportunity to have a practical appreciation of the map of what is really happening, who is saying what, where, and why, probably, in migration and health. Thank you, Joe.
Thanks, Blessing, very much. And I think that it's a lesson for all of us in just how much work is published out there, and in how hard it is to to find the work that actually meets what we're looking for, and meets what we set ourselves out to explore properly. Anything from anyone else?
Yes.
Melissa.
All right. Password, you can go ahead. I'll go after you.
Oh, sorry, I didn't see you persuade. Yeah.
All right, thank you. So for me, on my side, I'm also doing a scoping review as one of my objectives for my study. And for the scoping review, I'm exploring the interactions between food and dietary intake of migrants and their food environment. So actually for this one, is going in hand with me also, because for the data collection, I'm also looking at that for the data that I'm collecting. And so I'm also doing the scoping review first. So far, I'd put on hold the scoping review and I've collected my data. But during the proposal writing and all that, I've also discovered that it is important to do the scoping review first, because once we are doing the scoping review, we are reviewing, you see the methods, you see the summaries and the way that others have done it before. So it kind of informs your data collection methods. It kind of informs how you should, or kind of the lessons. You also get to know the lessons that others have done. You also get to know the limitations that others had in doing their study, and you see how you can mitigate them in doing your own study. So yeah, so for me, I'm exploring the interactions, and I've actually seen from this presentation that Joy has done that it is also a key highlight area that has been highlighted to say we also have to look at the dietary intake of migrants. We also have to look at the food security issues for migrants, and you actually see that there has been less focus on that. So it's quite interesting that I'm also doing something that is of value, and I'm actually doing something that has been highlighted, that there is interest in that area, there is need for research in that area. I'm also using confidence for my scoping review. I'll be using confidence, and it's manual. You can do it manually, like what Joy has been showing us on the confidence, that as much as it is a software that is, we are going to do it, it's going to do it for you, but you also do manually, you fill in all that information just as much as you do it on the Excel sheet. You also do the same on confidence. So yeah, it's quite interesting. Thank you for that presentation, Joe.
Thanks, Persuade. And we definitely need more evidence around migration, food security and nutrition. So I'm really excited to think that in a couple of years, when someone has to do the next review, your work will come up in there. So we're relying on you to help fill that gap. And it is a really important reminder, you said, about the doing things manually. It's a software, but it doesn't do the work for you. You simply use the software to facilitate
Yes.
some of the steps in the review, which can get you in a real mess. So thanks for that reminder. And then I think we were to Melissa.
Thank you so much, Joe, for such a thorough presentation, and also loved the infographics. But what I wanted to ask was, since the scoping review, since you're working with the World Health Organization on this scoping review, when it comes to the so what, also touching on what Blessing said on the areas that need to be prioritized, I'm just interested to know if there's going to be a follow-up from the scoping review where maybe the WHO actually responds to that to say, okay, based on the scoping review, this is how we're going to respond to the issues that were raised, and this is how these are the areas that we are actually going to prioritize. Because I've always asked myself, yes, we've done the scoping reviews. I mean, for me, it was the first time, and I'm just stuck with this scoping review, and I'm like, okay, fine, we're done, and then so what? Like, what's going to happen after that? So yeah, thanks.
No, absolutely agree. And I think that it's also about the processes that involve, international organizations and governments. It's like, well, what happens next? And for me, this does a couple of things. One, it helps like me as an individual, as a researcher, look to have a better understanding of where the current knowledge gaps are, and to hope that, working with students, working with funders, in setting that agenda. Now, this then went into a process of setting the South African migration, health, displacement research agenda, and that's about to be published. And that involved a whole process with different actors who were reviewing the key evidence gaps that were identified from the literature, but they were also contributing what they see as evidence gaps in their own work. So it wasn't relying solely on the published literature and the grey literature. It was also about, if you're a minister, if you're working in a ministry and we had some great group discussions during this consultation where they were saying, yes, there's lots about access, and yes, there's not enough about policy and governance, but what I really need is the data that tells us how to improve health information systems to capture migration data. So what they're doing is they're then saying, right, within where you've identified gaps, there's actually something far more specific. And so all of those kinds of research gaps were then fed into a very, very long list, and then a prioritization exercise took place, which identified a top set of research areas that are being prioritised. The department has committed to supporting addressing some of those gaps. A few years ago, there was talk of them having a small research fund. With McKetsy, we're trying to set up a national migration health task team, which will focus on research and knowledge gaps and collaboration with academic institutions to feed knowledge into the development of the NHI. Now, all of this is very ambitious, and when I'm having a day, I feel hopeful, and when I have every other normal day, I feel not so hopeful. But we have to keep doing what we need to do, and all of us as part of the research community need to find ways to ensure that the research we want to do, whether it's for our PhDs or as part of looking to raise more funding for our jobs, we've got a responsibility to follow the important intellectual work, but is looking at where we aren't doing enough research. Who do we need to collaborate? Who do we need to bring in from other disciplines to look at these issues? How do we encourage colleagues working in certain health issues to bring in the lens of migration to their work? So there is a process. There's a final report. You know, we all love a report, but there's a couple of reports coming out. This review is being published. But the idea is that there is then a process that's led by the national department for supporting implementation, and WHO will remain involved in that. So all I can really say is watch this space, and those of you who are planning your PhD or master's research, who are planning your postdoc topics, if you're focusing on South Africa, please do perhaps think about what this scoping review has identified. It was looking at specific things, so it's only going to ever tell us what that scoping review set out to explore. But I'm not supposed to share much of it at the moment, but I'll share some screenshots with you of the search strings so you just get a sense. But it will all be made available very, very soon, I think in the next couple of weeks. But yeah, I'll stop there.